I have been procrastinating on the 6 stages and 4 levels according to TCM for a long time. And the reason is it is a deep, difficult subject. And when I teach about the 6 stages and the 4 levels in school, my students have the deer in the headlight kind of look because they feel like, what is this about? I'm so confused. What's interesting to me is back in TCM school, we learned the 6 stages and the 4 levels during our foundation or theory of TCM. And I feel like it was much too early to look at something that is such a vast, big subjects because they both come from classics, classic books, classic TCM books. And those books are very big. The 6 stages is 1,000 pages. So when we look at this, we feel really intimidated and it feels very hard for a lot of my students. And even when I was in school, I felt really lost. So today, I'm all about making it easy to grasp and fun to learn. So we're going to try to grasp the basic. And then if you want to, you can go deeper into reading those classics because they're fabulous and very useful in practice. So what are we going to learn today? The 6 stages, the 4 levels, and how we can use them in clinical practice to help us look at the progression of a disease. So those are going to help us with our diagnosis and our treatment. Like I said, I'm going to try to make it easy for you to grasp. So breathe. You might have to go through this a few times before it all sinks in, but don't give up because it is such a great part of TCM. Are you ready? Let's do this. Welcome back to my channel. If it's your first time here, I'm Clara from AcuPro Academy, and I create Chinese medicine and acupuncture content for students and practitioners, making it easy to grasp and fun to learn. In TCM, diseases are not a static process. They are very dynamic. It changes all the time, right? Even when we see patients for chronic issues, let's say insomnia, as they progress, as they get better, we can see the progression of the disease. Now, today we're going to talk a lot more about acute disorders and their progression. We all know that when we get a cold, there is a progression. First, you start in the morning maybe with a scratchy throat, then you feel chilly and achy. By the end of the day, you're sneezing, you have stuffy nose, and you feel like, oh no, I'm exhausted, I need to go home, I have a cold, right? It took that whole day or a couple of days for the whole progression to occur. So we're going to talk about this today and how does that help us when it comes to TCM diagnosis and treatment to our patients. Now, I know in general, we see a lot more chronic disorders than acute disorders. However, specifically the 6 stages can also be used for chronic disorders. Not the 4 levels, but the 6 stages. The 6 stages and 4 level will help us diagnose more accurately and understand how deep the pathogen has gone. It also helps us predict the next stage and anticipate how the illness might evolve. And we can tailor specific treatment plan based on each stage or level. That's fantastic, right? Okay, so let's start by looking at a bit of history, and then we'll start with the 6 stages first and then the 4 level. The 6 stages come from the Shang Han Lun, and don't quote me on my pronunciation. The Shang Han Lun is translated as the Treatise on Cold Damage. It was written by Jing during the Han Dynasty to describe cold pathogen entering the body. Here's a cool TCM history fact. Jing lost a bunch of family members due to epidemic diseases and decided to write this book out of passion and grief. So it's not just theory, it is a heartfelt legacy. The 4 levels come from the classic book Wen Bin Xue. It's sometimes called Wen Bin Lun and is translated by Worm Disease Theory. It was compiled by Wu Zhutong and other scholars in the 1700s. Here's another cool fact about this book. The Wen Bin theory was ahead of its time. It even gave us the foundation for treating modern viral illnesses using TCM thinking. Don't you love that? I love when ancient medicine meets modern times. It's fantastic. So as you can see, the difference is there were scholars that believe everything that occurred acutely in the body started with cold pathogen invading the body. And then there were scholars that thought that everything that happened in the body was due to heat, external pathogen heat entering the body. So cold pathogen entering the body affects the 6 stages, and heat entering the body affects the 4 levels. Yes? Okay, so that's easy to differentiate at this stage, right? Now, when we have a pathogen invading the body, the immune system can respond to it. The stronger the immune system, the faster the body can push it out, expel the pathogen, get rid of it, and heal. The weaker the immune system, the harder it is to fight. It's kind of battle. It's like a war, right? So the pathogen can get deeper and deeper and deeper if nothing stops it. So we have little fighters that are ready to go to war with the pathogens. And unfortunately, if we don't have enough fighters, then the pathogen keeps winning. And we want to be able to push it out. In general, when people get a cold, they can fight it off, and then a few days later, it's gone, right? Same thing for a flu, a mild flu. Now, there are strains of bacteria and viruses that will try to penetrate the body, and the body cannot fight it because the pathogen or the virus and bacteria are very strong, right? Make sense? So let's start first with the 6 stages. We're going to go back to foundation because anytime you don't understand something or you lost or you're not sure what's going on specifically for diagnosis or even treatment plan, we want to go back to foundation. That is something I always recommended to my students over the years. And my teacher, my foundation teacher back in TCM school used to say, if you don't understand something, go back to foundation. And it is the truth. If you forgot something, for example, if you forgot that the heart is in charge of sweating, then when you see someone sweating with no reason, maybe just when they're anxious, you might not connect it to the heart. Does that make sense? So always go back to foundation. When we talk about foundation, it is also connected to the theory of acupuncture. I have an entire video talking about acupuncture theory. If you haven't seen it yet, the link is below. Check it out because it's very popular and it will help you understand how meridian function in Eastern TCM perspective, but also in the Western perspective, so you can explain it to your patient. Is that good? Okay, so make sure you check out this video on acupuncture meridian theory because it'll help you a lot. In that video, I go through each meridian and what their name. So the 6 stages are going to use those meridians and their names, and we're going to look at what level each meridians are. So let's start with the small intestine and the bladder meridian. One is hand meridian, one is foot meridian. So the small intestine and the bladder are both called Tai Yin, T-A-I, Tai Yin, right? Tai Yin is often translated as greater yang. So we're going to have 6 stages. The first 3 stages are going to be yang because yang is always more external and yin is always more internal if you compare the both, right? If you compare yin and yang, external, internal is yin, external is more yang, right? The skin is more yang compared to, let's say, your organ of your large intestine, which would be more yin. Now, people get confused a lot because if I say large intestine is yin, but that's a yang organ. It's always what you compare it to. Yes, large intestine is a yang organ compared to the lung, its yin organ counterpart. But if you're comparing yin and yang from external to internal, then the skin is more yang and the large intestine is more yin because it's internal. Yes? You're following me? You with me on that? Okay. Now, the first 2, small intestine and bladder, are called Tai Yin meridians, and they are at the top, meaning that we're going to look at 6 stages from superficial all the way to the deepest. So the most superficial meridians are the small intestine and the bladder. And it's easy to understand because they cover the upper back, right? Upper back, neck, and they come to the head, which when we have a cold or a flu, specifically, what happens when you get a cold? Oh, you have headaches, you have maybe a little bit of achiness in the upper back, and often we use a lot of those points to help the patients kind of push the pathogen out. So the top, more superficial level is the Tai Yin level. Yes? Okay. The next one is the Yang Ming level. So the first stage is where the wind cold happened, which is a Tai Yin Stage. The second one is the Ming Stage, M-I-N-G, the Ming Stage, which is the stomach and large intestine. And now the heat symptoms are going to come in because large intestine and stomach get affected by heat a lot, as you know. The Ming meridians are the large intestine, that's a hand meridian, and the stomach, which is a foot meridian. The Ming meridians, both large intestine and stomach, are going to be the second level, so the level 2. And so often we see this in practice. When there is a cold, it enters the body slowly and we feel achy and sneezy. That's why we have bladder points to help open the nose, right? When there is issue with wind cold invasion. Now this wind cold invasion, which is a pathogen, right, will penetrate deeper if the body cannot push it out. And now the problem is we may have now a little bit of a fever. We may also have sore throat. We may start coughing. Maybe we have nausea. Maybe we have vomiting if it's, let's say, a stomach flu, right? So the Ming level is going to look a little bit more with heat. Even though the cold pathogen started, remember from foundation, the 6 pathogens can really change and interchange into each other, right? We can start with cold or wind cold, and it can turn into wind heat. That is very common. By the way, if you're a student and you are writing exams soon, I have a PDF with 400 multiple choice questions and explanations, because you're not learning when you get it wrong if there's no explanation. You want to know why so you can learn and in turn next time get it right. Does that make sense? I go through everything. All the questions deal with from theory to acupuncture to everything, preparing you for exam. So make sure you check it out if you're a student, because it's very useful. The feedback from students have been amazing. The link will be below for you. Next stage is the Shao Yang Stage. Shao, S-H-A-O. Shao Yang Stage means lesser yang. Okay, the Yang Min, I didn't translate it because Yang Min means brightest yang, because Ming came from the Ming dynasty, so which was a beautiful dynasty. Shao Yang is the lesser yang, meaning it's the third stage, right? Tai Yang was the greater one, then we got the middle, which was Yang Min, and then the third stage, now we are at the level of Shao Yang. Shao Yang meridians, if you remember, are the Sanjiao and the gallbladder. Now, what's interesting is the gallbladder, if you look at it, and the Sanjiao also, they're very zigzaggy. They go zigzag, zigzag, back and forth, right? If you've looked at the meridian pathway. By the way, if you haven't seen my video on all the meridian pathways, because we need this to understand how we select point, I'll have the link below, because that video I think is key to be able to understand how to use acupuncture points once you understand the pathway with the external branch and the internal branch, because this is how we do acupuncture, to connect the external, where the point is, to the internal. So the Shao Yang stage is kind of like a mix of the first two. It's going to have some cold symptoms and some hot symptoms. So this is the typical alternating chills and fever. Alternating chills and fever. So we're going to have a little bit of chills, and then we're going to have a little bit of fever, back and forth. A lot of nausea, headaches. The person can be dizzy. Maybe they vomit. What's interesting about this is years ago, I had Shao Yang syndrome recurring all the time. When I first started, I said we can use the 6 stages and 4 levels for acute condition, external pathogen invading, and going at different level or stages, right? However, with the 6th stage, I mentioned that we can also use them for chronic issues. Years ago, I used to have chronic Shao Yang syndrome. And the Shao Yang syndrome was not an acute, but it was a chronic. That's why it's called a syndrome versus Shao Yang stage. And what I had was exactly this. I would have attack of migraine with chills and fever. I'd be sitting on the bathroom floor for like 6 hours, vomiting on and off, feeling so not good. I would have chills, and then I would be feeling hot, and it was just a disaster. And it got to the point where it was often and more often. At first it was once a month, then it was every 2 weeks, then it was every week. And I was just like, what is happening to me? I did so much test. Okay, many tests. We tested my hormone, we tested for parasite, we tested my gut, we tested everything. And then we found that the culprit. In North America, I cannot eat gluten. Me, the French girl who loves like baguette and croissant and anything that has to do with wheat. In North America, I cannot have gluten. Anywhere else in the world, if I go back to Europe, no problem. But here, I get a problem with gluten. The second thing that I found out is I cannot have coffee. My gut does not like coffee at all. So that also contributed. When I stopped the coffee, I went back to tea, and I love my tea. And then I stopped eating gluten in North America. This all disappeared. No more Shao syndrome. No more migraine, sitting on the bathroom floor, vomiting, nausea, chills, fever, and just feeling awful, where sometimes I had to cancel my day for my patients and I had to go home. It was just debilitating. So when there is migraines, we have to look for the root cause. And that takes a lot of detective work and clues and more clues. And it took me a long time to figure it out, right? So it's not easy when we have patients with migraines because we want to try to figure out the root cause to see if we can eliminate it. Does that make sense? Let's go back to acute 6 stages. The pathogen invade the body and maybe it gets to be a wind cold. Or maybe it gets to the second stage, which is wind heat. Or maybe it gets to the Shao Yang level, which means now it's heat and cold alternating, which means it's harder to get rid of because now it starts to really affect the digestive system. It affects the body as a whole. And it's definitely a little bit harder because it's a little bit deeper. Yes? Those 3 first stages are Yang stages, so they are called external stages. What's interesting with the gallbladder, I was saying it was zigzagging too, right? It is called also the revolving door. You know how the meridians zigzag? The gallbladder personality has a hard time making decision. It's back and forth, not sure which way to go. The Shao syndrome or the Shao stage is also called the revolving door because it's the last external stage and it's the door to get into the internal part of the body. If the pathogen is not expelled by the time it's on the Shao, it goes to the next level, which is now internal, and it's a Yin level. And that makes it much harder to treat, and everything is going to get faster and faster, deeper and deeper, and we're going to have difficulty getting rid of it naturally. So often the pathogen in the body are going to fight at that Shao stage, and if the body loses the battle, we go to the 4th stage, which is now internal, which is the Tai Yin stage. So Tai, T-A-I, greater Yin, just like Tai Yang, this is Tai Yin. The Tai Yin meridians are the spleen and the lung. So the spleen and the lung are the one that deal with qi a lot, right? With qi deficiency. So we're going to have shortness of breath, because the spleen is affected. We're going to have nausea, loose stools, maybe diarrhea, bloating, edema, water retention, swelling. Maybe we're going to swell in the face and we're going to get really pale. And because the spleen and lung don't like cold neither, and because the spleen does not like cold, we might start to feel chilly and cold. Celiac disease, for example, is a permanent Tai Yin syndrome. So that's not a acute problem, it's a chronic problem because there's diarrhea, there's bloating, there's difficulty in digesting, there's loose, super loose stools, the person is kind of cold and pale and fatigued. So that Tai Yin stage, if it's acute, that's when the pathogens get deeper and affects the digestive system. So parasites can do that as well, bacteria can do that as well, and we can have acute, but we also can have chronic. The 5th stage is Shao Yin stage. Shao means lesser Yin, and this is the meridians of the heart and the kidney. Now, the heart and the kidney are opposite. The heart is fire and the 5 element, and kidney is the water. And they are north and south, like really opposite. Summer, winter, perfect entity because the heart is in charge of the mind, the spirit, and the kidney is in charge of the roots of who we are, our grounding organ. So they're really opposite. So they need to be together, right? So the Shao Yin or lesser yin, and the reason it's lesser yin is because it has the least amount of qi and the least amount of blood. So when we look at meridians, the heart and the kidney meridians have the least amount of qi and the least amount of blood, which means when there's a heart issue or a kidney issue in TCM, it is going to be a little harder to get fast results. The results are going to get slow because anything happening with the mind or mental health takes a little bit more time, and anything happening with essence or kidney or genes obviously is going to take more time. So the Shao Yin stage is when the person is starting to have low-grade fever, which means it's kind of like elevated heat, but just later in the afternoon, not all day. So we feel kind of feverish at the end of the day. Night sweats, dizziness, tinnitus, and I'm talking about the tinnitus that is constant, right? Palpitation, anxiety, insomnia. It could be, again, a pathogen that went through the Tai Yin stage deeper, and now it's affecting the spleen and lung. Or it goes to the fifth stage, which now affects the heart and kidney. So those are the meridians, right? We started the meridian as the most superficial meridians of the small intestine and the bladder. The next ones are the stomach and large intestine, and then Sanjiao, gallbladder, spleen and lung. And then now we have Shao Yin, which is the heart and kidney. When we look at chronic, this is a typical menopausal woman is going to have Shao Yin syndrome. Heart and kidney is going to be affected. Lots of palpitation, anxiety, insomnia, but also fatigue, low libido. Lots of things are going to happen in the reproductive system, but also in the mental health. That is a very typical yin deficiency of heart and kidney, but also a menopausal woman may have that kind of syndrome. This is why I love the Shang Han Lun or the 6-stage book, because it's not just about acute disorders. It also relates to chronic ones. That's why it's really good in practice as well. The last stage is the Jue Yin Stage, and that is J-U-E, Jue Yin, which means the end of yin, the terminal yin, because it's the last. It's the deepest one. And the two meridians who are the deepest meridian are the liver and the pericardium, which is fascinating, right? Because you're like, wait a minute. But that's because the liver and the pericardium get affected by heat and also by cold. So it's quite interesting, right? It could be the opposite of Shaoyang syndrome, which also gets affected by cold and heat. But this one is much deeper. So there's going to be vertex headaches, because that's a liver problem when we have a headaches at the vertex. Abdominal pain that comes and goes, nausea, heartburn, acid reflux, vomiting, no desire to eat, and often very cold extremities, but really hot bodies. Yes? So hot body, but cold extremities. What's interesting about this is trigeminal neuralgia can be a Jue Yin syndrome because the pain is really, really strong, but it's burning, but the person has cold feet, cold hand, and they might vomit from the pain. They might have abdominal pain as well, or stomach pain, or it might be, the trigger might be food as well. So this is very interesting when you look at it. High blood pressure can also be a Jue Yin syndrome as well. So see, this is more chronic. But when it comes to acute, the pathogen was going deeper. That could be parasites. If we have intestinal parasites in the body, it's very difficult to get rid of. If you know, or if you have anybody around you that ever had parasites, it's not easy to get rid of. So they are deep. Does that make sense? So think of the 6 stages as the meridian that are trying to expel pathogen, and we want to keep our immune system strong so everything can go back up quickly and it doesn't go all the way down to the 6th stage or the terminal of yin. Now, one of the questions I get often is, can the pathogen invade at the 2nd stage or the 3rd stage? And the answer is yes. Can it skip a stage or 2? Yes. So it can start with a wind cold at the Taiyang level, and then the next stage could be right away the Tai Yin level. It bypassed the 2 in the middle, and now it's much deeper, faster. It depends on the person's immune system, but also that organ strength. If we have a very weak spleen, maybe we have a weak spleen, and that means that the pathogen may enter directly at the 4th stage, which is the spleen and lung or Tai Yin stage. So it doesn't have to go in order, but it always goes from superficial to deep. It just could enter at the 2nd stage, 3rd stage, or it could skip a stage or two and go directly from, let's say, Tai Yang to Tai Yin, and then Jue Yin, and skip the one in the middle, which is Shao Yin. I hope you're not too confused. I wanted to give you a little bit of an understanding of the 6 stages, so that way you don't feel completely lost when you look at them. If you haven't gotten my book, Chinese Medicine Made Easy, yet, you will love it. It's all about Chinese medicine theory and diagnosis, plus you get my fillable intake form so you can use it with your patients. This book is the basis of everything we do when it comes to diagnosis, because without a good diagnosis, it's very hard to get good results with patients. That makes sense? I'll have the link below for you. It ships all over the world, or you can have the digital version, which has tons of video links to complement it. And a lot of people get both. And if you're still struggling with your TCM diagnosis, I have a 90-minute masterclass that will help you. I have a framework in there. I taught it live, and now the replay is up for everyone to benefit from. It is so useful for people. So it gets you a framework you can use with patients and get the right diagnosis every single time. I'll have the link of the TCM Diagnosis Masterclass below as well. Check it out. You get an hour and a half continuing education and a certificate, and you have access to it forever, so you can watch it again and again if you need a refresher, which I think we all do. Link is below as well. Now that we looked at the 6 stages, how do we treat them? Well, most of the 6 stages, specifically from the book, the Shang Han Lun, are going to talk about formula. It's a very specific book for formulas. So if you are doing Chinese herbal formulas, you are going to love this book. If you don't, yeah, it's going to be a little bit of a tougher one, but it's great for understanding diagnosis. It's a long read. Like I said, it's over 1,000 pages. It has many, many translations out there that you can check out. Obviously, we can do acupuncture as well. And if you want the treatment for each of those stages, formula and acupuncture point, it's all in my book, Chinese Medicine Made Easy, my green book. So you can look at them. And I also have a slide in there that has all the chronic disorders that are associated with each syndrome, like the Tai Yin syndrome and the Shao Yin syndrome, etc. So it really will help you when it comes to using the 6 stages in the clinical practice. That's the made easy on the 6 stages. It's very fast. This should be like a 7-hour class, but I just wanted to give you a little bit of an understanding. I hope it's really, really useful. Have you subscribed to the channel yet? Smash that subscribe button now, because you don't want to miss out on all the content that comes your way. I hope I haven't lost you yet. Let's talk about the 4 levels. I think the 4 levels is much easier than the 6 stages. Yay! The 4 level scholars really looked at everything that happened in the body comes from external pathogen heat. So every level is going to be heat, more heat, more heat, more heat. We have 4 levels. The Wei level, W-E-I, which is the defensive qi, right? Wei qi, defensive qi. The Wei level, which is the most superficial. The qi level, which is the next one. The yin level, Y-I-N-G. The yin level is the nutritive level. And the last level, it's the blood level. Wei, qi, yin, and blood. When pathogenic heat enters the Wei, or the defensive level, we're going to have acute fever, very mild chills, a sore throat, a frontal headache, mild sweats, a thick yellow nasal discharge, probably a yellow coat on the tongue, and a floating rapid pulse. This is your typical wind heat invasion in TCM. Does that make sense? The next level, if the body cannot fight it, it might go deeper. And when it gets to the qi level, it might affect 2 different organs. 1, it could affect the lung, and 2, it could affect the stomach and large intestine. So what happens if the heat penetrates to the qi level and invades the lung? We're going to cough sticky, yellowish, green phlegm. Not great, but that's how it is. We're going to have the fever is going to be higher than at the Wei level. We're going to have dry mouth, thirst, sweating, a red tongue with a yellow coat. Probably the front of the tongue is going to be even redder because the front of the tongue is the lung, and a rapid pulse. Now it's not floating anymore because we're at the qi level. We're no longer at the Wei level. Make sense? When it is at the superficial level, it's floating, but not anymore. It can also invade the chi level, but affecting the stomach and the large intestine. So we would have high fever again, but this time really profuse sweat, even more than when it's affecting the lung, with constipation, because it's affecting stomach and large intestine, irritability, bleeding gums, which is a stomach heat. With the constipation, when we have the bowel movement, it will be very smelly. That's excess heat, right? The tongue is red with a dry yellow coat because now the heat is starting to dry the fluid. And the pulse is rapid and big. The next level, we're getting to the point where it's the yin, Y-I-N-G, yin level, which is the nutritive level. And that is very high fever that is going to be worse at night. So the person has high fever, but at night it gets even higher. Very restless, irritable, insomnia. They cannot sleep at all. They may even get delirium or delirious. And they may have rashes all over the body. Red, dry tongue, thin, rapid pulse. What can that be? That could be the measles. Easy, rashes all over your body. It's high fever. It could be one of those. That makes sense? Okay. And then the last level is the blood level. So if the pathogens goes deeper to the blood level, now we're really, really deep. And so the fever is very high with rashes all over the body, but now there's nosebleed, convulsions, delirium, completely no sleep whatsoever. The person does not make any sense. The tongue is really, really red, like crimson, and the pulse is very thin, still rapid, but it's weak because it's at the blood level and it's really drying the fluid and it's affecting blood. So a few years ago, my husband got viral pneumonia. So not bacteria, but viral pneumonia. And it's exactly what happened to him. It was at the blood level. He was delirious. He would get up. He could barely take 2 steps. And then he would say, I'm going to go to work. I was like, no, I don't think you can go to work. He lost 17 pounds, which is about 7 kilos in 3 weeks. We were trying to figure out what was wrong with him for weeks. We went to the CDC, the Control for Disease Center, and they couldn't figure out what was wrong with him. It took a long time to figure out that it was viral pneumonia. He recovered. He's very fine now. But that was really 3 weeks. That was quite scary. And he was definitely having that heat invasion that reached the blood level. And when it comes to viral pneumonia, they don't have any medicine for it. So we had to do it naturally. We had to do it by waiting with time and strengthen his immune system for his body to fight it back. But it took a lot out of him. And if you've ever had pneumonia, you know it takes a long time. When people get sick and they have bacterial or viral infection, it's really important to strengthen their immune system after for quite a few months, right? Like not just like a week or 2, but for the next 3 months. Build that immune system back because it got so depleted fighting for your life, really, that it's really important to build that system back for the next few months. I had a patient who had mononucleosis when she was 13, and she came to see me in her 20s, and she still had fatigue. She was still exhausted because mono gives you that viral fatigue, right? So it's really important to help nourish that immune system. And we can use point like Lung 7 and Stomach 36, but also we can use supplement, good diet, sleep, a whole lifestyle that we need to educate our patients so they recover and then their immune system gets stronger. Now, all those 6 stages and 4 level we talked about today, we can explain any pathogen invasion through those 6 stage or 4 level. From a bladder infection to bacteria or viral problem, this is how we explain. We use those to try to see the progression of the disease and how we can help expel the pathogen faster so we can recover. Wow, that was a lot, but take a big deep breath, and I would review this a few times until it makes sense in your head, right? Because it's a lot, and you can go deeper. You can read those books, but I hope that gives you an understanding and a basis for those 6 stage and 4 level. I wanted to thank you for your continued support because without you, I wouldn't enjoy what I'm doing, which is to teach. I love to teach Chinese medicine because it's amazing, right? We all know it rocks. Watch this video next, and no matter what, keep rocking it using TCM because after all, acupuncture rocks.